Yeah, well, we need to, there's different causes for that. Sometimes it is actually emptying properly, but you've got what we call an overactive bladder. So the bladder's contracting even though there's no urine in there. But usually, if you can feel it's not emptying properly, usually it is. And often you'll empty your bladder, you'll walk away from the toilet, and then you need to go again. So you'll go back and do a little bit more. And that's quite common for a lot of people. It can be a cause of a prolapse in ladies. So if you've got a prolapse into the vagina, it can stop the urine draining. With men, it can be a sign that the prostate is enlarged and all the urine isn't coming out. So again, you'll go, and then a few minutes later, or as soon as you leave the toilet, you feel more urine, you have to go back and do it again. And that's actually called double voiding, which is something that we teach you to do when you can't empty your bladder properly, is to go and then walk away and come back, and often you'll get some more urine out. But we need to diagnose initially that is what the problem is, that it's not something else, because it could be. So you need to see your GP, tell him you're having these problems. You might also start to be getting urine infections, because that's a sign that you're not emptying completely. If you leave a bit of urine behind in the bladder, it's not like sort of a stagnant, but it grows more bacteria in it. So it's very important we know you've got this problem so we can fix it to prevent urine infections. So see your GP. He might be able to feel if there's urine in the bladder, because some gentlemen with an enlarged prostate have got, I had a patient once who had 3.5 litres of urine in his bladder, and he'd no idea because it had come on so slowly, and it suddenly started to feel as if it was emptying, and he got 3.5 litres in there. So sometimes the doctor can feel that urine in the bladder, and he'll pop a catheter in and drain that bladder and measure what's in there. But you can also get a referral to the Continence nursing services for a bladder scan, because that's the way we'll diagnose how much urine's in your bladder and if you are emptying properly. It's a little handheld scanner. All the Continence nurses carry them, so they just pop it on your tummy after you've emptied your bladder, and it measures if there's any fluid in there. And that's a lot easier and less embarrassing than having a catheter put in. So we always send them to the Continence nurse to get the scan done. And if she finds urine in there, we teach you how to empty your bladder better. So we teach you the double voiding, walk away and go back again. We teach you to make a ball with your fist, press on the bladder and rock backwards and forwards. That can also help. And we might need to teach you to sit differently on the toilet. A lot of people sit forwards and slump when they empty their bladder, and if you've got a large tummy, that can stop the urine coming out. So we teach you to sit upright and just lean slightly forwards from the hips and relax that tummy, and that can be often all you need to do. With some patients, we actually have to teach them to empty the bladder with a catheter. It's a very small catheter, not the type of indwelling catheter with a bag. It's a very small, thin catheter. It's about that big for ladies and a little bit longer for men. And I've taught a child as young as 7 to do this, and a lady who's 84. So they pop the catheter in, empty the urine out, and then you take the catheter away, wash it, dry it and reuse it. And lots of people use that to manage their incontinence, especially people who've got a neurological condition such as multiple sclerosis, and they can't empty the bladders properly because there's the signals from the brain to the bladder aren't getting through. Then they manage their incontinence and their overactive bladder and prevent urine infections by doing this. So children such as spina bifida children may need to do this for life, and all kinds of people need to do this for lots of different reasons, but it's nothing to be scared of. It's a very simple, quick procedure. It literally is in and out in a few seconds. So there's something we can do for that to help. But you might need surgery, because if you've got a large prolapse or a man with an enlarged prostate, they might need surgery to fix that problem. Yeah.